Hello, this is Dr. Yang. This is a story about Lonzo Ball having had a surgery, arthroscopic knee surgery for a torn meniscus. So let's see what if you for those of you who don't know, Lonzo Ball is the second draft pick for the NBA Lakers last year, and he had a good first year. Of course, it's hard for him to live up to his dad's expectation, and but he's a solid rookie. Again, there's we have to remember there's only 400 players, basketball players that makes it to the NBA at any one time. And so that's 400 players in the entire world. So just to make it to the NBA is pretty good, but that's why it's just exponentially harder to be even make it to the All Star level. So even though you don't make it to the All Star, you're just to be the fact that you're in the NBA, you're pretty good. And so let's see the knee injury again. I don't know what exactly knee injury he had, but let's look at the knee anatomy. It's basically three bones. Okay, the femur, which is the thigh bone, is the tibia, which is the shin bone, and then it's the patella bone. Okay, and then between that, there's these meniscus, which is a C-shaped cartilage on either side of each knee. So there's two meniscus, medial and lateral meniscus for each joint. Then that meniscus sort of allows the two bones to sort of stand on one another, and so it helps distribute loading. And then you got a lot of these ligament from the patella, from the quadricep tendons to medial. Here, let's see another picture here. Let's see, is that? I think I had another photo in here that showed a good picture. So again, here's the medial and lateral meniscus with posterior anterior cruciate ligaments. Now that's the lateral and medial collateral ligament, and then there's a patella tendon on top of it. So anyways, so when you when you stand low down on your feet, these meniscus sort of protect the bone from hitting one another. So these type of tear, the injury tend to happen when when you step down on your feet and then you make a twist. So they sort of rub against each other and then the meniscus gets torn. Sometimes you also get hit from the side, twisting and a side or the inside collision. It'll end up with a meniscal tear. So let's go back here. So the quadricep again is the front of your upper leg, and again muscle generally contract, right? So when you contract your quadricep, you extend, you strain your lower leg, and when you contract your hamstring, and again it contract, and so you pull back on your lower leg, which you end up flexing your lower leg. So let's see. Again, I don't know exactly what type of tear Lonzo Ball had. And sometimes, again, that's associated with injury, undiagnosed injury of all these ligaments around the joint. And so I don't know if he has injuries of the other ligaments. So these are the type of meniscal tear. Again, this is C shape on one side, C shape on the other side. Okay, so you could have tear here. They call flab radial, longitudinal, buccal handle, degenerative, and horizontal. Cleavage. Again, the specialists that people usually see are orthopedic surgeons. Sometimes they have subspecialty. For doctors, they operate on the knee, or sports medicine, orthopedic surgeons that does a lot of knee surgery. So in general, let's take a look at this. Here's another photo showing, again, this is looking from the top, what we call a cross-sectional view. So when the tear here, basically, again, okay, let's go back to the symptoms. Okay, so basically, when you have tear, you have pain. Again, that's especially on the two side. In the front would be the patella tendon, but especially on the two side of your knee, that's where most of the pain and swelling and tenderness is. And considered treatment would be just involve typically what we call RICE, which is rest, ice, and then compression, putting a compression dressing on it, and then elevation, keep it elevated so it doesn't swell as much, and just sort of lay off that injury. If it's not too severe, they could do some stretching exercise to strengthen the quadricep and the hamstring muscle, sort of just to strengthen the support of it. However, sometimes if the pain persists with conservative treatment, especially if there's locking, if there's piece of the meniscus getting torn off, the knee can sort of lock, and if the swelling and pain persist, then you sort of have to. Then the doctor would sort of consider that you might need an operation. Now, and the other thing is sometimes when you have little piece of meniscus that's torn, they may actually affect the articular cartilage and damage the articular cartilage, and that could lead to further injury of the joint. So when doctors go in here and do repair, again, you got the vascular, the outside is more vascular, right? So any tear in that area, you should be able to repair better, versus if you tear the white zone, which is more the inside, central, it's a little less vascular, less blood vessel, and things don't heal as well. And so in that area, sometimes you have to do what's called a partial meniscectomy. They remove the broken portion of the meniscus. And they could do this with laparoscopic surgery. If you look at this, basically it's just, they stick in, there's a couple of different ways. You could do it with, I believe, local anesthesia with some sedation. You do some numbing and then you get some medication to the IV. They sort of get relaxed. Or you could do it with a nerve block, or you could do it with them intubated on a ventilator. But you basically put in a scope and then you put some surgical instrument in there, and you could look in here and look for the tears and repair them. Again, there's a picture of what it could possibly look like. Again, just trying to get into that space there and to access the meniscal injury. So this is sort of the scar, poking a couple of holes in here, and the recovery from this procedure is generally relatively quick. Again, these are NBA athletes, so they have to load those joints a lot. So I guess how he recovers, we just have to see how he recovers, actually how he does in practice and in game time to know, and whether there's more pain, more swelling, more locking, more discomfort. And post-op, again here, during again, it's outpatient surgery. You have the laparoscopic surgery, you could generally go home. Surgery generally lasts about 1 to 1.5 hours, depending on type of meniscal tear. And after surgery, about the post-op visit, usually it's about 10 to 14 days. They take out stitches and give physical therapy prescriptions, and 6 week you could do range of motion checks and return to some activity. Again, this is after partial meniscectomy, where they take out the little piece of tear. You could actually go back to sports activity a little faster. 12 weeks is the final checkup. Now, if it's injury that's small enough or in the more vascular outer area, they could do a meniscal repair. And I think there was a photo in here where they, you could see them putting stitches in there. But anyway, after meniscal repair, usually it's actually a longer recovery. It's 10 to 14 days. They, remove sutures and you could get a physical therapy prescription. At 6 weeks, you could remove the brace. And then at 12 weeks, you could return to some sports activity. So again, I don't know exactly what Lonzo Ball had, but I definitely hope him do well. I would never want to people to we always want people to recover from their surgery well, right? As upset as some people may be about his father, I mean, we just want people to do well from their surgery. Let's see if I cover everything. Oh, the other thing is that actually I was looking for a meniscal tear suture photo. Okay. Well, the other thing to speed up healing, other than physical therapy, strengthening the other muscles around the joint and the ligament around the joint to provide more support. I know some athletes in general, maybe not even for a meniscal tear surgery, but just in general, they could go do hyperbaric oxygen treatment. And what that means is they go into a chamber where the oxygen level is high and it's at a larger pressure gradient. So in that case, theoretically, hyperbaric oxygen after serious treatment increase the blood oxygen level so high that it actually causes new blood vessels to generate. In more blood vessel, more nutrient, and carry away some more of the toxins, and people tend to heal faster. And so I know some athletes do this just for sports recovery. So I don't know if Lonzo Ball is doing this or not. The other thing is PRP, which is a platelet-rich growth factor. Platelet in general in your body, basically when you cut yourself or when you have an injury, your blood vessel opens up and the platelet goes to that area and put a plug on it, okay? But once it put a plug on it, it's not done. It releases a lot of growth factors to call out all the other cells. Hey, I have injury here, and let's come and fix it. And so the theory of platelet-rich plasma is that you take the person's blood down, you spin it down, and you take out the portion of the platelet that's floating in the middle with all the growth factor concentrated, and then you inject it into the area of injury, in this case, the knee, and then it's gonna basically tell the body, hey, I need more healing, more than usual. It's just a lot of growth factor, and the body will generally heals better. Again, some doctors believe in this, and some doctors don't. I know supposedly Tiger Woods had this done before to speed up healing. So again, I don't know what Lonzo Ball had, but hopefully he's recovering well. And again, we want Lakers to do well, just as we want the Golden State Warrior or any other team, to do well. Again, this is Dr. Yang, and I appreciate you very much for taking your time to look at my channel. And again, if you're enjoy it, please support me and hit the subscribe button and the like button, and feel free to share with a friend. Thank you so much. Bye bye.